Thank you guys for being flexible. My name is Jill James. I work with NFP, which is your benefits broker, and we work with the General Health District and Lake County on all of your benefits program. We work with all of the carriers, insurance carriers, and our role is to help negotiate the best program for you, not only in price, but also in the benefits that are being offered. My role today, I look at it as very much, this is one of my more favorite things to do, and that is an education piece of talking about what are your benefits. I realize there are some changes people are aware of, and it's like, well, I will do my best to answer any questions. I also realize that sometimes people are going to have personal situations they may want to talk about later. So if I'm not available later, or you think about it and you have a question, please run it in through Adam and they'll get it to me. Or if you need to just say, can you connect me with Jill some way, we will work on coming up with a way so that we can connect and do a virtual Teams meeting or a virtual office hour so that I can help you with whatever the issue is. I know I'm spending a lot of time in Lake County right now. We want to make sure you understand your benefits. And I think too, coming out of COVID, we've had several years since we've been able to be face-to-face. Things have just kind of been run through the same, we're doing it the same. But one of the things that's also happened with COVID is we've seen a huge spike in the cost of healthcare. Not only, and unfortunately, we've had a lot of very sick people in Lake County, some very sick people in Lake County, but we also have had a rising cost of healthcare. And so part of what we have done is an analysis of where that cost is. How do we get our hands around that without changing too much of the program's schedule, deductibles, and looking at how is this set up so that we can manage that cost but still give you a very rich benefit, and that it's something that you can use as you take care of yourself and your family. So I'm going to walk through at a high level. I'm going to start with page 3, which is your overview of your benefit guide. I'm going to talk at a high level and then we'll delve into details. I'll give you the disclaimer that this is a high level view, okay, of your benefits. If you want to deep dive into how is my benefit, I have this situation and this condition and how will it apply, keep in mind you have a summary of benefits and coverage, you have benefit summaries, you also have certificates that are available to you. The 2023 documents are being developed right now by Medical Mutual for the medical side of things, but we did send out like the benefit kits and benefit summaries for the other lines of coverage. We have sent those over for your use. Look at those. That is going to be the more comprehensive. This is the high level, and I'll get into that, and then I'll dig into it a little bit deeper, but you let me know where your questions want to go on this. Okay, so let's talk about your plans. You've got 2 plans. The Lake Blue plan, no change, okay? There is no change with the Lake Blue plan, same as it has been. I will talk in more detail on the Lake Blue plan, primarily because I find a lot of people, I think that this is one where maybe there has needed to be more understanding of how this 3-tier plan works and understanding that Lake Blue network, especially since Lake Health was sold to university hospitals. So I'll go into that with a little bit more detail. Your EPO plan, which I think majority of people in the General Health District are on this plan. This is a grandfathered plan if you're on it. This plan, the biggest change is instead of making a change to the deductible or the schedule, deductibles, copays, is that a decision was made to move to a narrower network. So the difference in this plan, the schedule stays the same, but it is a new network. It is the MedFlex network. Probably the most obvious difference is that there is no coverage with the Cleveland Clinic in the MedFlex network. Now, the EPO plan, you can look up the MedFlex network, and the EPO plan has always been a plan where there is only in-network benefits. So that, I just like to say, that part has not changed, but now that network is narrower. We'll get into more details about that soon. Your prescription drugs are still with CVS Caremark. Your dental plan, this is going to be a new carrier. This is moving to MetLife, so a little bit reduction in price on the plan. They've matched the same plan designs, so same plan designs, but It is a little bit less in the premium that is paid. So this was able to be a significant savings to move from the self-funded platform to MetLife. We did an analysis, and I think it's pretty heavy concentration that your providers are still in network. I do always suggest every year it's always a good refresh to make sure your provider is in network. Vision is with IMED. Basic life is with Guardian, that continues. And long-term disability, this is moving over to MetLife as well. Telemedicine, this is still with First Stop Health. One of the things that Lake County is doing, instead of it being the virtual mental health that they had this past year, they're expanding that to being a virtual primary care. So it's not just virtual mental health, it is now virtual primary care is available as well. What that means is a more robust program. It's something that I think we're seeing more and more across the healthcare industry is virtual health. My family's out of Maine. So I look at, for being in remote areas in Maine, this is awesome. But also, if you think about where we use care, when we think about care, it's not always an 8 to 4 or 8 to 5. It's after hours when the kids are out of school, out of practice. Thinking about how do we use virtual, how do we use primary care for ourselves? If it's our maintenance medications, we want to set up that appointment to review our maintenance medications with our primary care. There are going to be ways you can look at that virtual primary care. Again, this is free. If you haven't already downloaded the app, I highly recommend it. Get that downloaded on your phone. It's a great resource. And then the last one I'll touch on this page is the Employee Assistance Program with Ease at Work. Ease at Work does a beautiful job. They're a great partner in working with Lake County on making sure that you have resources available to you, emotional, legal, financial support, whatever you're going through in life. You get up to 6 sessions, and I'll talk about this more. They will coordinate, if you need more sessions, they will coordinate that with your healthcare plan, where there is also mental health benefits. I can't stress this one enough. There was a time we never talked about EAP with, it may have just been a throw-in, and that's how people looked at mental health. But I've already started my week with hearing about suicide attempts or people who've been in, shooting incidents. I work with a lot of municipalities. I work with some schools. I work with teachers. I look at the different people and what they are facing with their benefits or what they face in their employment. I just was at a library. They deal with the public just like you do. It's tough. It's tough, some of the things you face, and we want to make sure you have that support. So personal work, that you've got that resource. So, all right, you guys ready? I'm going to start diving in here. All right, part of the Lake County program, tobacco cessation program, just so you know, if you or your spouse are on the plan and you smoke, you will be paying more. There's a $20 fee extra if you smoke or use tobacco. So that's part of the county program. Touch on that. Eligibility. I'd like to also mention, if your spouse has coverage with their employer, they're not eligible for the County General Health District plan, and they need to complete the spousal waiver form. So just make sure you're looking at that spousal waiver form, or a spousal, if they are on the plan, a spousal statement of employment. So that needs to be completed. If it's not done, I can guarantee Norma over at the county is going to be calling and looking for that form. That can be uploaded on Ben Express. You can complete that. It's in the back of your packet. It'll be up, and you can, just scan it and upload it into Ben Express. Qualifying events on page 5. I mention this because it seems every year I have someone who will come to me 60 days, 3 months, 5 months out from when they had a qualifying event trying to get coverage for someone or drop coverage. This is your annual open enrollment. By law, you can make changes to your plan, your benefits, during this annual open enrollment. Add, drop, change. The only other time you can do this throughout the year is if you have a qualifying event, such as marriage, birth, divorce, adoption, change in job status, if someone, your spouse loses coverage, change in status. These are qualifying events where you can make changes to your benefits. You have 30 days to do so. This is a big deal. As I mentioned, my son was born 4 months early. I remember there was a child in the hospital bed few little isolates down where their parents hadn't gotten him registered with